It's a wonderful day. Today, 8th November at 4 p.m. We are talking a very important topic. You know, when we initiated, when the thought came that we must have how safe our medical institution. Myself, Srini and Mamshi were very excited that whole country will be quite keen to know what's happening and what are we trying to talk about it. Um, but as we progress, you will know the critical component that is missing in medical institution. That we will talk about it and welcome all of you. So today we are going to talk about safety of our medical institution and critical role of the technology in enhancing it. Okay, healthcare facility face unique and pressing security challenges. So when you Google and see, the statistics indicate that violence against healthcare workers is 4 times higher than the other private industries. I also read 60% of the healthcare professionals feel very unsafe in their facility. It's quite alarming. 60% of the healthcare people feel very unsafe. Why? Furthermore, data from Joint Commission shows that over 60% hospital security incident involve patient aggression, underscoring the urgent need for comprehensive security measures. So while 90% of the medical institutions have implemented basic CCTV system, as we are talking again with DP, CCTV you see everywhere. You walk into any hotel, any clinic, small time medical shops, you go to any hospital, you find cameras everywhere. But what is beyond that, beyond CCTV? How are they implementing? You see, when you go to the security room, you will see large, very screen, multiple monitors. There is a security chap sitting with his walkie-talkie, looking at the monitor as if there is something going to happen immediately, looking at all the monitors. So when the layman enters a cabin or in the room, he gets scared as if he's sitting in a nuclear, the control room. You don't need all this. We are out. Today, we are talking about AI. The technology has changed. Your CCTV actually is an intelligent component. How do you make intelligent? You have everything, but you don't know how to use it. So today, we're going to talk about, most of the institution, 90% institution got a CCTV, but that is just a CCTV. Just look at it, but does not provide you enough data for you to analyze what it can. It can also predict. Today the technology, what Mr. Srini and Mamji, how do you predict, the incident? So we're going to talk about only 5% adopted VM, the video management software, a solution that provides real-time surveillance, enhance the incident response, and act as a deterrent to unauthorized access. So this gap in technology adoption highlights the potential for VMS to significantly strengthen safety protocol in healthcare setting. So today we'll talk about how do you implement beyond technology beyond CCTV, just surveillance. So focusing on tailor-made, integrated solution that comply with regulation and best practices. So implementing robust VMS system is more than just technology progress. It is about creating environment where healthcare professionals and patients feel safe and protected. When I said 60%, they don't feel safe and protected. We can assure you, if you implement this technology, every healthcare professional feel safe and protected. And you've seen the incident happening in Kolkata and multiple, location. Very unfortunate. You have CCTV, but still you're not able to get the footage. You're not able to retrieve data. Now, when you say, cameras are being masked, so we as a layman think that once you remove a camera, once you mask the camera, you will not know. Even the security person will not know. But it is wrong. If anybody touches the camera, anybody goes near to the camera or somebody masking the camera, still you can get alert. This particular camera is masked, or somebody has removed this camera. When such technology is available, when the era of AI, why we still say, the police says no, there is no information available because somebody has masked the camera? It is not right, because today very affordable. The technology is not so significant high. You must today. The session is very important to all my healthcare professionals who joined. We have very fantastic response. Very well-known hospitals from Mumbai, Delhi, Bangalore. They are from Kolkata. They are from Middle East. I'm happy to see a lot of response from Middle East also coming in for this webinar. We're very keen to know what is beyond CCTV, what is there beyond CCTV to protect their facility. So let's today discuss an exchange, and I would like you to put as many questions to these expert speakers today. Let's make it more interactive. We will have 30 minutes of presentation. How do we enhance the security in medical institution? After that, we'll take up questions. So let's make it more interactive session. So today, topic on security with interaction. So looking forward to see you. And as I said, I'm from the fire and security industry, founder of Fire and Security Association of India. As I was saying, we speak more about fire, but security is only 5% of the component. So I was telling Srini and Vamshi, awareness to be created among how do you use the CCTV, how do you use the surveillance. We need to have an independent society for surveillance professional or a security professional. Though I have 4 different society, if you see every area, I think there's a need to have security professional association for security professionals. So my colleague, friend Srini, he's regular to our webinar. He's coming and exchanging his ideas and thoughts. So he has a wonderful experience. His passion has been identified to create innovative product. One such, that Durang solution that you're going to see, is a brainchild of Mr. Srini, and his passion for developing innovative ideas made him a serial entrepreneur, founding and advising many startup companies. He's also the co-founder of CRO of Durang Inc., a leading video surveillance and analytic as a service. They are the only company in India, other than there's another company in Kolkata, the only company in India who develop in-house software. They've developed video analytics, video software in Hyderabad. So he has been instrumental in shaping the product design, features in providing market insight. So his mantra, can lead corporate India to become world economic leader. Wonderful to have that statement from Srini. So we have another colleague, Mr. Vamshi, who joined us today. He's from Hyderabad. So Vamshi, again, with 25 years of experience in managing people, managing projects, operation, technology, infrastructure, people, and customer management. Years of large experience dealing with culture, the cross-cultural team from customers from across the globe, including US, Europe, South Africa, and Middle East. As a head of operation of Durang for the past 8 years, he has overseen development, implementation, and support of cutting-edge Durang Vision smart surveillance solution. With a strong focus on quality, he has spearheaded implementation of ISO 9001 2015 and ISO 27001 for product development and technical support process within the organization. He is a technical evangelist. He advocates and helps customer benefit from and understand the limitation of the technological innovation in the surveillance industry. So these are the 2 speakers today, 2 experts on the subject that we are going to talk. So I would now welcome Srini to open the session with your opening remarks. I want to unshare the screen. Over to you, Srini.
Thanks, Dominic. It's always been a good experience and exposure discussing a lot of things with you. And, from fire to security to safety and electrical safety, you span across everything in the, industry. So Today's subject is, very, very, very important because there is a lot of changes that are coming up in the hospital industry, like, healthcare industry. There are chains of large hospitals coming up. There are, the institutions, core ecosystem is changing. To keep it in the perspective, if you see, a large hospital got every kind of a flavor in it in terms of security and surveillance. We security professionals always get amazed by what are all things that come across in the hospital. Hospital got a flavor of like airport, it got highest footfall. Like a mall, it got like a heavy duty parking situations. Like an educational institution, it got like a lot of people coming for the learning purpose. Sick patients are there, which needs a lot of attention. So if you see, it's like a hostel, it's like a hospital, it's like a hotel, it's like a mall, and also an airport. Having said that, if you have so many flavors and all that you are doing is just putting, a ton of cameras, 100 cameras, 5,000 cameras, and then just leaving them to the fact that we don't know whether they are recording, we don't know whether they are working, and just the individualized implementation of each floor or each DVR or each NVR, not combining all of them together to one single platform, you have a lot of issues that happens. And that's one of the reasons why when you have safety and security at the medical institutions, there are a lot of gaps that actually crop up. So having said that, Vamshi got a flow of a presentation which we will explain. Some of these, 45 minutes, 1 hour is very difficult for us to handle this. Like Vamshi said, it's always very important to have evaluation of existing surveillance system that is implemented there and assessing the gaps and the risks. A qualified consultant or a technical expert or a risk assessment expert has to be given a job, a task to assess what is there today before we give our technology to get implemented. So if you have a wrong camera implementation, and if you are trying to build a VMS, you are trying to put analytics on top of it, it's going to waste a lot of money and budget, and then so recombining or reworking out the existing system is very important to start with. So that I think should be the starting point. And AI can be process improvement solution also. Computer vision, you can read your X-rays, you can read some of these things. Let's not go that far as of now. First let us fix what is the basic fundamental surveillance scenarios are, and then opportunity to prevent untoward incidents becomes completely opportunity based. Healthcare management and surveillance infrastructure and periodic reviews and audits and reworking out of these cameras. Most of the time, I'm very surprised to see the in-house electrician becomes, the expert in the surveillance. Just you call him and say, put a couple of these cameras. He doesn't know what is the field of view. He doesn't know what is the overlapping of cameras. All that he is doing is he's fixing a roof, ceiling mounted camera, bullet camera, if is available, or, different kind of cameras. Sometimes I see outside cameras, which are supposed to be in the parking lot, kept in the inside of the building. So these are the things, challenges, because like you said, it is the gap between what is available and what can be implemented. That awareness is not available with the in-house team. So having said that, we need to recommend some kind of an audit or a review process periodically.
True, Srini, very well said. So let's hear out from Vamshi. The very simple, 60% of the healthcare professional feel very unsafe in their facility. Let's see what Vamshi wants to say about it.
Absolutely. I think this is a topic that needs wider participation from wider audience and need to take inputs from the industry professionals as well as security professionals like us. And that's why this webinar or session is very important and crucial It won't be a one-way talk because what we can do for healthcare specifically needs to be in alignment with what the industry requires. And these are some of the thoughts that we put together in terms of what needs to be done to improve our to where we are to today to where we can go or where we should be moving forward. So that's what we want to focus on. I think you have given a very good introduction in terms of why this session is important. So I thought that I would keep as a first slide, but since you have covered anyway, most of it is addressed from your point of view in terms of the various incidents that you mentioned, the frequency of those incidents that are happening. So that is what makes this session important, because these incidents have wide-ranging impact, not just on the people that undergo those issues, but they not only the people who are directly involved, but also damage the trust, increase the stress among the healthcare professionals, and then erode the confidence of patients and families. So it has a wider ranging impact, and that's why it is critical to address the safety and security needs in medical institutions. While we talk about AI, as you were mentioning earlier, AI has a lot of other important ramifications for the healthcare, which is in terms of detecting tumors, etc., which is an entirely different field. Like Srini also mentioned, in terms of automatically reading the CT scans or radiology department, those kind of things are we are not focusing on that aspect of AI today. We are only focusing on the safety and security aspects of using a video management system to that extent. So we are limiting our focus to that extent today in this session. As I mentioned, the impact that ranges in multiple ways, not only the healthcare providers, because they are directly in the line of fire, they most often get confronted by the angry or distressed family members of patients. So frequent reports that we hear about that, they feel burnout because of that. They get anxiety and burnout, which are already high among the healthcare workers. You already mentioned 50% of the healthcare professionals do not feel secure. And this results in loss of empathy or professional detachment, and then ultimately affecting the quality that the patient receives in terms of the care. So it has that wider range impact. And then from a patient family perspective, this loss of trust or this distrust can lead to the patient families becoming hyper vigilant and then turning confrontational on the administrators, which in turn creates tension within the hospital staff. It's like a vicious cycle. Because of the lack of trust, they become more confrontational or hyper vigilant in terms of the kind of care that they are getting, etc. So these affect both sides of the angle and also the everyone within the healthcare system also. So to protect everyone in these institutions, we must address the safety gaps with strategic and effective security solutions. So let's look at typically what we observe in the industry is that this is what we typically see. Like we already discussed earlier, there are a lot of cameras that are kept deciding where the coverage should be, etc., to the extent possible. Once it is designed, it's fixed. And typically, there may be somebody monitoring it in some cases. Maybe there is nobody monitoring it also in many cases. Only when there is some incident that happens, you go back, try to diagnose what is the problem, and then do an evidence management. But even when somebody is monitoring, we know that studies show that the attentiveness drops off dramatically after 20 minutes of continuous monitoring of anything. And especially when you have multiple cameras in a location, it's all the more difficult. And when you expand to multiple locations, then it's even more difficult. You will not know what happened at one location versus the other location. So your ability to respond becomes heavily people dependent, whoever is monitoring that. So and each person's capability and commitment levels are different. So we cannot completely depend on human activity alone. When there is availability of technology that can augment it. So when there is nothing available, yes, the only way is dependent on humans. But when there is a possibility for technology to aid in the efforts of humans, it should be welcomed and then taken advantage of. That's what we try to promote. In terms of the typical common weaknesses that we observe in the system, I guess it's probably can be an open point of discussion among the three of us. While I initially put these 3 points in terms of the CCTV installations themselves are typically ad hoc, and Srini touched upon the point that most of the time it's It's whoever is the layman or the electrician fixing up. Sometimes you realize that there was no camera in let's say, important corridor. Then somebody fixes that camera there. It's an ad hoc approach. It's not a holistic approach that is taken. But whenever there is a need, you fix up some cameras. When there is some incident that goes undetected, then you try to see what has happened, etc. One of the studies, of mid-sized hospitals in India revealed that only 40% had comprehensive CCTV coverage. This again points to the same point you mentioned in your opening remark of 90% of the locations were only having the CCTV cameras, but no video management system. And that is one of the causes that exacerbates this problem. And the second aspect is outdated equipment and limited monitoring is an additional thing, because most of the time, whatever cameras are kept were initially designed a few years back, but they're not reviewed periodically in terms of the available resolutions that they're using. Because whenever then there is an incident that happens, if the resolution is not sufficient and you are not able to identify the actual person through the image, then it's of no use if you cannot detect it. So it's important to periodically review what type of resolution we are using, how many days of storage we are keeping, because when we set up, probably due to whatever limitations, you could have set X number of days of storage for these cameras. But then as the time period increases, as the number of cameras increases, that automatically decreases because the available storage remains the same. You don't think of increasing the storage as per the number of cameras that keep getting added over a period of time. So, and then monitoring of these, whether somebody is monitoring that or not, even when somebody is monitoring, how effective is it, is an important aspect. And final point is that integration with emergency protocols. You would have defined protocols in terms of your codes and emergency response systems, whether it is fire or smoke alarms, etc. How are they integrated with your surveillance technology? Are the cameras integrated? Are there any IoT devices that you are using, like a smoke detector, like a glass break sensor, etc.? When they are used, are they integrated with your surveillance equipment, CCTV equipment or not? So if there is an incident that is triggered, how easy it is to ensure that flows seamlessly into the communication systems. So that is also very critical to evaluate and review. So these are some of the points that need to be reviewed when we look at a holistic approach of providing proper safety and security for the medical institutions. And why are we talking so much about it today is because the medical institutions have both legal as well as ethical responsibilities towards ensuring the safety and security of not only the patients or the inmates, along with all the healthcare workers. So both from a legal perspective, there are requirements in terms of the number of days the storage needs to be available, and also from a ethical responsibility in terms of patient privacy. For example, is your CCTV system allow you to keep, let's say, privacy mode where the faces are not recognized or are blurred, or the image is blurred, for example. So that's as an example. So you have multiple things to consider in terms of both legal requirements and also your ethical responsibilities towards your patients and the providing of the care. Yeah, confidentiality and privacy definitely is one of the aspects. You focus a lot on the patient healthcare data, but at the same time, even surveillance needs to be considered along the same lines of how it is aiding in terms of deterring, providing the confidentiality and privacy, but at the same time ensuring that the unauthorized access to confidential areas is restricted, for example. So surveillance systems fulfill both these needs. They combine both of them from a compliance perspective and also from an ethical perspective by deterring the threats, ensuring accountability, and providing real-time response capabilities. So what we observe to ensure that we address those needs, to address the weak points or weaknesses or the current lacunas that we find, and the need for implementing a stronger safety and security environment within the medical institutions. These are the two aspects that are very critical that we see. There needs to be, involvement of a professional security design, starting from if it is a greenfield deployment from day one, from the building architecture onwards till final operations. Because typically, unlike commercial spaces, medical institutions don't consult security experts to plan their surveillance setups. It's basically, okay, we don't want to put anything in ICU because of the privacy. That's regular statement, for example. And then we want to keep cameras in the entry-exit points. Maybe entry points are covered, lobby areas are covered, and we are good. So, but is it solving the actual purposes? If there is a security expert that can be brought in, he can review the overall design of the building, both from a safety security aspect and also from a fire or evacuation perspective also. So multiple angles can be reviewed and then a holistic approach can be taken. That's how the hospitals can benefit by involving the right expertise. And then one is that in terms of the design and setting up. The second is the regular assessments that need to happen. Like Srini mentioned, periodic audits are critical because technology evolves, changes. The requirements also change. What you see as a requirement today may not be the same after a couple of years. So it's important that regular assessments are conducted, evaluations of what are your emergency or security risks. Are the gaps created by either expansion, because we keep expanding, you add another facility, add another block, etc. So whether it's these gaps get created by expansions or by technological advancements, because what is not possible today may be possible tomorrow, and that can help you take more advantage of these systems. So security design consultants will be able to recommend upgrades to these to address these issues and ensuring the system remains effective and aligned with evolving standards and safety compliance. So addressing these gaps requires a systematic approach and the involvement of professional security design consultants as a starting point.
I just want to add one point, Vamshi. See, just for the wider perspective of the whole thing, all these institutions invest so much time and energy in terms of designing these expansions and designing, the facilities and all those things. But when those expansions are happening with the, either interior designers or the architects, a lot of times the conversation with the surveillance experts is missing. So if they are added to the conversation, then it becomes more effective.
Definitely, yes. So as we move along in terms of the professional security designers and implementations, some of the key design considerations, even internally are immediately that we need to look at our overall as a security or safety aspect. What we need to see is to have an approach that combines both physical security, because obviously physical security will be involved in overall ensuring everywhere, whether it is security at the entrance, security at the ICUs, etc. So physical security and how they communicate with the electronic surveillance. So both need to be hand in hand, along with implementation of any video analytics that are possible to be deployed. And then collaboration with the staff, training of the staff in terms of how the technology can be used or how the VMS systems can be put to better use, and periodic training to those people. Ensuring your emergency response plans are also integrated into the surveillance.
In the aspect of collaboration, I just want to add one point, Vamshi. See, a lot of times surveillance is not just the command control center. And that's the misconception. Most of the implementation goes directly hard implementation of ICCC is what we call in our industry. And it is important. We need to have an integrated command control center which comprehensively monitor everything and manage the events, triggers, and also configurations and data storages and all those things. I'm not denying that. But the thing is, if you have so many, the security officers, security professionals, and non-security people who are supposed to use these CCTV cameras for a specific purpose, like some of the areas which is secure areas like MRI rooms and other places, when people are not supposed to go and somebody has entered into that, who should get the notification? And when the system defines that this is the person who should get the notification, it should be easy for them on the handheld devices to get that message, to access that information, forward that as a workflow to another officer or whoever is on the job or on the shift, and then take care of that immediately. So that workflow is what is very important, and that only happens with the proper implementation of VMS?
Yes, no matter how, unless you define that workflow, it won't be easy in terms of taking up appropriate action in a timely manner.
Exactly.
So for that, the workflows definitely need to be defined properly. So there's no communication gap or gaps in the steps that need to be taken. So from a technology adoption perspective, what can technology do in terms of helping or aiding in the safety and security of it? It can provide transformative solutions, because especially with AI-powered video analytics, they can provide enhanced safety and security in the institutions. They can detect unusual behavior patterns, for example, such as someone loitering in the restricted areas, or the presence of unauthorized individuals, allowing security to respond before the incident even takes place. So many institutions, fires are exacerbated by delayed detection typically. So an AI powered smoke and fire detection will help in terms of ensuring immediate proper action, minimizing the response times, and helping in evacuating of the area and the patient safely. So there are multiple ways in which the AI interventions can help in terms of the safety and security, because they can also detect altercation, for example, in an emergency room that can be promptly identified. They can also detect unusual crowding in critical areas, such as in many people gather around a single room, for example. It could indicate a medical emergency, or it could indicate a violent situation. So these kind of things, if they are brought immediately to the notice of the security officer, and they can be able to take immediate action on it. So we will take a closer look at how Durank Vision can provide these solutions specifically designed for the healthcare environment. We have considered why it is critical to look at safety and security aspects of a medical institution, and what are the impacts or ramifications of not having a proper implementation. What are the typical points that need to be considered in terms of enhancing the safety and security, and how it can be implemented is what we've looked at in terms of ensuring the periodic assessments or audits involving the right security professionals in terms of evaluating that. So then we are moving on in terms of implementing or aiding, taking advantage of technology with a VMS solution such as Durank VMS solution. So what Durank offers is an advanced video management system that can integrate your existing cameras, any maker model, because we know each institution, even whether it is one location, whether it is multiple locations, there would be many type of cameras, makes and models that would have been deployed, depending on availability or the budgets or the technology or the requirements, etc. So any of those cameras, all makes and models, can be brought into the same platform for ease of access. You can have any number of users created in your system, and then enable who will have access to what. A department specific, let's say, will have access only to departmental cameras. An administrator can have access only to the billing sections, for example. A security officer, a security guard may have access to the outdoor perimeter cameras, for example. So when you bring in all the cameras into one fold, and the system gives you the ability to say who will have access to what, solves a majority of the problem, because you're also protecting the privacy and confidentiality of the patient data, because you are giving access to only the people who are authorized to access for that particular camera, not as a bulk. You have an NVR, you log into the NVR, you have access to all the cameras. So that will not be the case. So you can define who will have access to what camera. And then when you have especially multiple locations, branches, etc., is there a possibility today for you to seamlessly connect and see what is going on there? Late in the night, let's say you get a call saying that there is some incident happening near the ICU, and then there are emergency room, and there are a lot of people crowding happening there. Do you have the possibility to have eyes on the ground? Will you have immediate access to it? So how easy it is for you, no matter what type of network technology is available there, whether it is broadband connectivity, Wi-Fi networks, or whatever. Is it possible to bring multiple locations into the same fold and give you a simplified access? Is another aspect that is very critical to look at. And then how scalable the solution is. The solution that you implement today needs to grow along with you, because today, if you have X number of cameras, tomorrow it will definitely grow further. So, and how easy it is for your security officers or administrators to access this, because we don't expect or we don't require that the people who are using this system need to be technically so competent. The basic skills of using a keyboard and a mouse or internet browser should be good enough for them to handle, like how the Gen X kids are able to use or watch, for example, YouTube. How simple it is for them to use the system is how the security and surveillance should be. And that's what Durang focuses on, with no additional softwares, no plugins, simply an intuitive browser interface that allows you to watch whether it is live that you want to see, whether it is the recordings that you want to fetch, whether it is the incidents that you want to create or configure, or the looking at the incident tracker of what action has been taken for a specific incident. All of that is done simply through a simplified user interface. And it offers a lot of flexibility in terms of your storage. Like if you're, for example, you have an NVR and it has X GB or TB of storage. And as your cameras increase, the available storage for each camera reduces automatically. Whereas with a VMS solution like Durang, you can specify how many days of storage is required for each camera at an individual camera level. So some critical cameras, you may keep more number of days of storage, may 30 days. Some cameras maybe 7 days. So it's up to you. It gives you a lot of flexibility in terms of what options you can configure in the system. Some additional key features are, you can keep track of the device health. This is a very important aspect. Like we mentioned, once the camera count goes over a couple of hundred cameras, it's very difficult for anybody to see what cameras are live, what cameras are not working. And the problem becomes exponential if you add multiple locations to it. So the system should give you an eyeball view of simplified view at bird's eye view. How many cameras are there total in the system and how many are live as of now? And if any camera is down, get a notification for it that this camera is down, and then that can be taken care of, whether it is an issue with the hardware, whether it is an issue with the network. But as long as you're not aware, you won't be able to fix the problem. So the first step is to be aware that these are the cameras, these are the number of cameras at this location, X number of cameras are not working. So this is an important aspect that you don't realize after the fact that, yeah, there was no recording for this camera. This is very important as a proactive step to ensure you have a view of the camera health. And then you have a possibility to create a floor map of the institution, the hospital or the college, and then say where the cameras are positioned to be able to understand what is the coverage and which camera you want to access from a graphical user interface, be able to quickly review, go to that particular camera, see that camera's live or recordings, etc. We spoke about confidentiality, etc. So the solution also offers a privacy mode where the images are blurred so that you are protecting the privacy, but the events get triggered. If there is a crowding, for example, if there is a loitering, the events keep triggering in the backend, and then the appropriate person can see those events, but not the live view of all the cameras. So there are, like for example, in ICU, this could be used to detect a patient fall by protecting the patient's identity. So we not say which patient are you don't not recognizable because it's blurred, but then you will know if the patient has fallen. So like that, there could be
just another example, Vamshi, about the ambulances that we have done, where while the patient is getting transported from the location to the hospital, while we are giving live feed to the doctors that are there in the ER, they are able to get the live feed and also view of the patient, whatever the process that they've been supported with. But otherwise, nobody else will be able to see it because it's a blurred image. So that gives the privacy to the patient. Also, at the same time, if the family want to see while the patient is getting transported, they also can get a link, automated link, where they can actually watch while the patient is getting transported all the way to the hospital. So all these flexibilities are there with just a simple browser interface. Like Vamshi has said, you don't need a high-end knowledge base to adapt to this simple VMS, but the functionality-wise, it is very seamless and everything is done in the background. And what the interface-wise, it has been minimalistic, and then it has been created as if people doesn't need to have a lot of technical knowledge to either configure, administer, or to watch, or to forward these links to do the next level of processing. So the system is very, very simplified so that everybody can be able to use it.
Yeah, definitely, and that's how we all the complexity is hidden underneath, and for the user, it's made simple. So even the command center view that we provide in the system hides all the complexity behind. No matter from which camera or which location there is some incident that got triggered, it gets popped up automatically into the command center, providing you immediate live view of that particular camera also. So you get a live view of the camera. You don't need to go searching for which camera it was, where is that camera. Pull up that view of that particular camera. All that is simplified. So an incident gets triggered somewhere, that camera image comes immediately onto the command center view, and along with the live view of that particular camera, so you have an immediate view on eyes on the ground. All of that is integrated with the AI solutions. So there is no other integrations that are needed. It's inbuilt in the system itself. Some of the benefits we spoke about in terms of adding any number of cameras, whatever make or model of cameras, any number of users having access to it. Security is assured. Entire platform is built with security as a primary key concern area. We spoke about the camera health notifications. Important aspect is also the time-lapse video, wherein it helps you to review the video feed very quickly. An entire matter of, let's say, a day of video can be condensed into a matter of couple of minutes. So you have a quick view of what actually happened or what transpired, and helps you in terms of quickly diagnosing incidents. The creation of this time-lapse video is an important aspect also. And the external views is something that earlier Mr. Srinivas was explaining in terms of when the patient is getting transported to the ambulance, we can provide the live link to the patient's relatives or the family. So that is done through an external views link that we can create as a shareable link that is accessible only for a specified duration of time. Yeah, and this, if you understand what I'm saying, is basically that the ability is not only for the fixed cameras, but even the cameras that are on the move can be connected through a 4G or a technology in the ambulances or a moving vehicle. All those also can be connected into the same platform seamlessly. So you don't need another solution or another device or another login for that. It will be integrated into the one same VMS, whether it is the camera is a fixed camera in the institution or whether it is the camera is in the ambulance. So you will be able to have a combined consolidated view of all of them together. And we move on with specific integrations with AI because the video analytics are integrated in the system. A couple of them we spoke about in terms of whether it is fault detection of aggression in specified areas. This can be done. The artificial intelligence, AI pod, video analytics, they can offer this detection of unusual behavior patterns. Loitering detection can happen. Anybody who is not authorized entering into specific areas can be detected. Even facial recognition can be used at areas where it is appropriate to use. It can detect for an alert for physical altercations or violence, etc. They can track unusual crowding patterns in areas, then indicate taking immediate action. It can also do a process improvements in terms of utilization of OTs or other facilities. It is also possible to detect whether it is occupied or not, the bed or the MRI machine, for example, whether it is occupied, how much is the utilization of that during the day, even as an operational improvement that is also possible through AI. A few more use cases that we spoke about, they are geared towards the situational awareness. They can do compliance and risk management also in terms of automatically tracking vehicles. If there are any vehicles that are blocking in the ambulance pathway, if there is anything blocking in the fire exit, for example, those can be automatically detected, ensuring compliance and risk management also. So AI is an additional layer on top of the existing VMS system or your existing cameras, basically, not the VMS system. On your existing cameras, these can be applied because it doesn't require specialized cameras. So that is the beauty of the Durank VMS solution. There is no need to replace any camera to take advantage of whatever we were speaking in the last few minutes. So all of that can be done on existing cameras, including the interventions of artificial intelligence on these cameras. With that, I conclude the presentation. So we can get on with any questions. We try to cover as much as possible how strategic planning and technology is important in ensuring we have proper coverage and safety and security is enhanced in the system. So would like to open the floor for any questions.
Vamshi, can you put your number there under the Q&A last slide, your email ID and the phone number? Yeah, I can see.
I'll add the phone number. I just put this slide with the email ID, but yeah, I'll mention in the chat as well.
Okay. Ladies and gentlemen, what I would request you to raise your hand so that I can allow you to have one-to-one interaction, live interaction with Srini and Vamshi. So if you can raise your hand, I can take you live so that you can chat with him. So I already have a person now. Before I take few questions, Tara Dal I'm allowing you, so you can ask this question to.
Everybody, good afternoon. It's a very wonderful lecture and wonderful information. Right now, we are making a lot of hospitals, but this sort of information was not with us earlier. So we are doing many critical care and super critical care hospitals, and they are basically public hospitals. So in public hospitals, we need to differentiate the patients depending upon their categories, like say very critical on-moving and OPDs and some IPD patients. So that way, the patient services has to be monitored from a central command room. So how this will be occurring in a public hospital of G+5 building, say about 2 lakh square feet, where we have got all services like say laundries, we have CSSDs, we have got ICUs, OTs, IPDs, OPDs, and emergency systems. So how it can be done within less manpower, within 1 or 2 manpower, so that we can share the details of ELV drawings. So and in which way you can do one example? Can you please deliver it on that?
Sure. Vamshi, let me take it a little bit, and then you can, add on some points. This particular requirement, what you're mentioning, it might be multiple locations, and then you might need command controls for each individual location, and also centralized command control for all the locations together. That's the first aspect, where you connect all the cameras to one single platform from all the locations, bifurcating them in the system itself as separate nomenclature and then separate, listing. So group by the location cameras and group by the functionality wise. All these things are available in the system. Like you mentioned, the flavor of the ecosystem, the environment of each building, G+5, there are multiple things. And these multiple things are managed by multiple functional officers. So those officers are interested in only their functional areas. So bifurcating that in the VMS and then providing them access live to them and incident-based or event-based, so that they don't need to waste their time, but they actually attend to the important aspects, is what the VMS actually purposefully built for. So my request is, like, if there is a possibility of us to get the blueprint or to give us a chance to visit the location and then give you a suggestion, that we will be interested in do that. Vamshi.
I think you've addressed it fine, sir. So we can take it up as a specific requirement, understand what is your specific requirements and how is the current design, and add with our comments and suggestions and feedback can be provided.
Okay. So there are a few questions. Thank you, Mr. Taradal. Thank you for asking this question. So I would again welcome others wants to have direct want to speak to him, please raise your hand. I will allow you to speak to him. Okay. So just 1 minute, remove permission to talk. Okay. Sudarshan is asking, does the institutions comply with national and local safety and health regulations? Who would like to take this question?
I guess that
I'd
is
like
for
to be
the
politically
institution.
correct.
I guess that is
That-
for each institution to review and check what regulations they're complying with or not. We are here to provide guidance in terms of how these compliances can be achieved.
Achieved.
Not to define those compliances or whether any definitions of it, but how those can be complied with using the available technology.
See, the primary interest of us is to understand whatever the implementation currently is and how much gap is there to analyze and how to fix these issues. So that's one of the aspects that we will be actively involved in with the institution. We'll help them out in terms of assessing what is the risk right now, what is the implementation that is done right now, whether it is prudent to move around of some of these cameras so that they become more effective. Instead of adding more cameras, just realign them and then reassess them and then give some kind of a auditory notes, basically saying that this can be better used by moving around. So some of these things that we help out, because end of the day, whatever is fixed there, you don't need to waste them. You need to use those infrastructure that is already done. Maybe it is a wrong implementation, but realign them. That's what our primary goal is.
Okay, I'm not able to understand Ayahu question. He says required human to support. So he says any functions. So you need human to support for always, which is not offered by any organization. So with security, only AI replying means no meaning at all being a human being. I'm not able to understand. Is it a question or is he saying that technology cannot, complement AI? I don't know. The question is not very clear. But anyway,
Basically, I think it's a comment, Dominic, that AI cannot replace a human, which is definitely agreed, because
Agreed.
AI is there to augment the human efforts and make the life simpler and easier rather than trying to look at as a replacement for any human being. There is no way, because we are not at a stage where actions can be taken by robots yet. So AI can help detecting an incident, but what needs to happen for that incident need to be defined by humans and need to be acted upon by humans.
So you would say technology and human has to be compatible. It has to have a complement. You can't have just everything AI, but no human interaction. Not be possible. So we also have a very interesting participant, Mr. Gautam Goradia, who is also going around the country talking about writing books about auditing of the CCTV footage and all that. My point is on not that, Gautam. Gautam, why, the question is our country, just supply, you today you can get camera in any retail shop. Even Airtel is, offering Airtel with their broadband, giving a standalone rotating cameras, Wi-Fi camera. So anybody can go pick up a camera and ask your electrician to just wire and do it. So today, the CCTV is well aware. Everybody knows what is the purpose of CCTV and all that. But what is missing is here. How does it that the entire the image or the incident can be reported and even avoid the incident to happen? So you have been going around. Why that awareness is not coming into people's mind? We have lack of awareness on whether it is VMS or auditing. So what do you say, Gautam, on this?
Thank you, Dominic. Very nice to connect with you as usual. Hello, Srini and Vamsi. Vamsi, if you remember, we spoke with each other a few weeks or months ago. And I'd love the opportunity to discuss this with you. So let me come back to something very, very basic for the entire audience. CCTV cameras or surveillance cameras are a source of information. And by the way, a very nice presentation to both of you. And a video management system is an absolute requirement to manage all these cameras. The title of my book explains my philosophy. And if people go by this philosophy, I can tell you for sure that the entire landscape of video surveillance will change. The title of my book is See What the Camera Saw. Simple.
Yeah, here.
Simple. Yeah, thank you, Dominic. Thank you. If you see what the camera saw, in whichever way, whether you use the buzzword of artificial intelligence, nobody speaks of video analytics anymore. If you use auditing as a very, very powerful tool, audit the footage as a standard operating procedure. And the camera should not only be used to solve an incident. See, please remember that cameras are watching everything 24/7 by 365. Now, I heard many times about the word incident. Please remember that an incident can be solved only if it is reported. The camera sees everything, and if an incident like patient self-harm, very important thing in a hospital, or ill treatment of a patient, very important. Issues like, I've seen issues like even animal intrusion in hospitals. So there can be plethora of things that can go wrong in a hospital. And sometimes large hospitals will have 200, 300 cameras. The unfortunate RG car incident, we don't know how often that person had gone to stalk the doctor. We don't know, but the camera knew it. And therefore, smart technologies, not necessarily smart in the sense of technology, but technologies must be such that they solve the pain point. And because here we have a hospital as the audience, I'll just give you one small example and stop there. When you have a headache, in India, you are prescribed a Dolo. Abroad, it's called paracetamol. For a headache, you don't prescribe chemotherapy. So if we believe that AI and such buzzwords will solve all our problems, it is not going to happen. It is a combination of technologies, like a wonderful VMS like Durham, a combination of technologies and auditing and smart data management, smart reporting. This will bring a drastic change in the world. I hope I've been able to add some value to this wonderful presentation. Thank you for the opportunity.
Dominic, you are on mute.
My question, Gautam, why that awareness is not coming into including IT, we call security professional or security consultant, or the facility project managers? Why don't they have this, component in the BOQ or the tender specification along with the cameras and the NVR, VMS and other software also?
Yeah,
should be part of it, isn't it?
Yeah, completely agree, Dominic. A lot of changes are happening in the country. As a matter of fact, after the sad incident that took place in Maharashtra at Badlapur, the Maharashtra government has passed an order now. It's an order that every school in Maharashtra has to check. They've not used the word audit, but they've used the word every school in Maharashtra has to check its CCTV footage at least thrice a week. Now, I can tell you it will be impossible for them to do so unless there is a specialized technology, because playback is not an easy game. It's technically very difficult. So auditing will happen. Audit findings have to be recorded in a certain way so that you get business intelligence. Slowly, when, Dominic, anything that is new, people have reservations and people try to fight against something which is very radical and very new. But slowly the industry will come together, and auditing, I am sure, will become a part of the video surveillance ecosystem. Because remember that you can only, when you come to automated technologies, it can only do what it has been programmed for. So if it's programmed for 1, 2, and 3 things, it cannot do 4, 5, 6. It cannot do the unexpected. It cannot do the unknown. it will happen, Dominic. Let's remain positive.
Well said. I am optimistic. Yes, we need to keep driving these kind of awareness, these kind of webinars and all that. But I'm sure we will reach where we intend to.
I would love to hear Srini's views on what I said.
No, absolutely, Mr. Gautam. See, the aspect that we were talking about initially when we started was the auditing in terms of, the infrastructure audit. That what you have added, the information is about the footage audit, like the data audit, and also the audit of the regular periodic audit of the data that is available in the CCTV. Like you said, that CCTV do watch 24/7. So the tools that we have available will do the AI on prescribed manner, right? So it does manage, and also it does record, and it does store. And playbacks also is easy. Sometime we will show you, one of the demos when you have time, how the data can be retrieved in terms of VMS with the Durant. So there is definitely a possibility of understanding both ways. We are not, denying the fact that at this stage of the technology, so there are a lot of things that need to progress, and those progress need to be done in a periodic way. So when it is need to be done in a periodic way, that's when you need to revisit your implementation. You need to revisit your infrastructure on a periodic basis, like whether it's 6 months or 1 year. Keep assessing what you have and keep assessing what is available, and start enhancing those. But I do agree on your point of auditing, that the field level of auditing is one of the elements in the ecosystem has to be included.
Thank you. Thank you. We have Muthuraman. Muthuraman wants to talk to you, Srini and Vamshi. Sir, please go ahead.
Yeah, so thank you for giving the opportunity. And I want to know that only one point, other than
Sorry, by mistake, sir, please, sorry, go ahead. We got disconnected.
Now, are you hearing my voice, sir?
Yeah, go ahead.
Yes. Yeah. Generally, cameras and all used are everywhere in security purpose, in 724, whatever it is. But exclusively any Durang having additional features in the medical system.
So his point is what he's saying, do we have features in VMS exclusively designed for hospital purpose?
Okay, so here is the main important aspect. The VMS portion of the solution is basically to make sure the management of the cameras, integrating of those cameras from multiple locations, and then storing of the data and the retention of the data with the resolutions. And also the access of the data is very precisely defined to the users who are supposed to access that. That's the primary aspect of it. The secondary portion, which is actually integrated AI analytics within the stack of our technology, is the one which actually enhances your periodic requirements. See, the video analytics are not a package. For the security purpose, you may have a very standardized analytics that are there, but we have not included the process-related analytics that can happen with the existing CCTV cameras. See, the computer vision can do much beyond the security. That's why our tagline in Durant itself is do more with surveillance. So when you have a surveillance camera in an MRI room or in an ICU, what is exactly that you are trying to look for is what we want to know, and then customize and build an analytic that is required for the hospitals. Every hospital might have a different requirement. Hospital as such is not like very uniform. When I say, one chain of hospitals have a different process related things compared to the other one. This is where our customized analytics can help in terms of, addressing those problems or addressing those things, and then build custom analytics for them and deploy within 3 to 4 weeks. Each analytic use case or requirement that is sent to us, it will not take more than 3 to 4 weeks for us to develop and deploy.
So basically, Mutram, okay, go ahead, Vamshi. I'll join that.
Just one point that I wanted to add was these requirements, sometimes vary depending on the size of the institution and also the environment in which they operate, whether it's in a rural area versus, what kind of area they operate in. So that those determine the kind of AI or the interventions that you might want or what kind of information you would like to see. And then having said that, some of the specific aspects of VMS, like privacy enablement in the system, is something that immediately can be taken advantage of as part of the VMS. And then the ability for taking the video feed from the moving vehicle, for example, is another aspect that you can take advantage of when you're transporting across facilities in an ambulance, for example. So there are some aspects that you can immediately take advantage of, and there are some aspects that may need some customizations, especially with AI interventions, which are perfectly possible to be done.
Sir, and I want to know something to you. For example, when patient is entering the hospital, suppose your camera can detect that patient body temperature, whatever, then it can be immediately emergency to doctors. These and all your VMS can do in the system?
Yes. So, your use case is multiple fold, Mutram. One is we can recognize that patient's face and retrieve that data or send a trigger to the external system, which is your hospital management system, and say that this is the person who has entered. And if the camera temperature is detected and the temperature anomaly is higher, that also can be reported through the hospital management system. Or if the hospital requires it to be sent to some specific person as a WhatsApp message or a Telegram message, that also can be done. So see, our VMS system is a very open architecture. We can take input from any devices, whether they are IoT devices or cameras or some other devices. And also we can process that information and then send specific related data as metadata to the external systems. That is one way of doing it. The other aspect is when we take input from the cameras, we can also process that and send it to the third party. So either we can take input from the third party devices, or we take the input from cameras and then create some kind of alerts and then push them as APIs to the external systems like hospital management system and others. So we have a very open architecture in terms of inbound APIs and outbound APIs.
Okay, thank you, sir. Because actually we are the EPC contractors, sir. Nowadays, every company during tender period itself, they are asking camera system. So we have to incorporate all the safety features also in that camera system, so that your system will support all the features, even external features also. We can recommend for our clients. So that only I am asking this question. Thank you for
absolutely.
answering.
Anytime, Mr. Muthuraman, we can actually collaborate, and then in case if you need any further information also for a specific kind of a requirement, we can actually customize, because like we said, like Durank is completely built in-house. There is no third-party solution or third-party related tools that are there incorporated. It's fully built in-house, so a lot of customizations can be done.
Thank you, sir. Thank you very much.
Welcome.
Yeah. So we are almost done, Srini. Our topic was, is our medical institutions are safe, or can, is it safe and secure? And how do we make medical institution safe and secure? The answer is yes. There are solutions, there are technology that if rightly implemented, we can make the medical institution very safe. As I said, most of the hospitals have more than 500 cameras. In some of the hospitals, there are 1,000 cameras. The managing that the trace topic, if you can effectively manage it by implementing with the right technology, you can avoid a certain incident, the violations, as I said, there are a lot of aggression in the emergency ward, where the patient they bring in, suddenly, patient is dying because of various reasons. So the aggression. So when the crowd start gathering, so camera can detect that it is, it has become very volatile situation that need extra security there. So you can control, you can predict, certain issue that can arise. Similarly, ICU, your MRI, all that can be protected through your existing cameras. Only thing that you need to have is you need to have right experts, right technology there to recommend and find a solution for you. For that, we have our partner Durang. They are based out of Hyderabad, and as a Blue and Gray, we have partnered with them because we both share same, ideology that yes, every institution, every building need to be safe and secure, whether it is electrical, whether it is fire, whether it is security. So we are in the business of, protecting lives and property. That's the interest that I have with Durang. So I want to bring in them. So again, we will be coming back on 20th of December with very interesting topic where Vamshi will be addressing, and again Srini, of course, will join us. So we look forward for you, and we will be sharing this recording to all of you. Please get in touch with us again. And tomorrow we have another webinar on early fire detection. So continuously, yesterday we had different subject, and today about making institutions safe. Tomorrow we have how to enhance the early detection in your building. At 11 o'clock tomorrow, we will be hosting that webinar. Look forward to see you all again. So thank you, Vamshi. Thank you, Srini. Thank you for spending your time. Lovely to have you again. Bye-bye.
Thanks, Dominic. Thanks to everyone.
Thank
Thank you.
you.
Bye-bye. Take care. Bye.